So for this skill, I'm going to be performing a reconstitution of a powdered drug. But before I do anything, I'm going to check the physician's order, note the patient's name, any allergies, and make sure that this is the correct medication that I'm going to be giving. Then I'm going to wash my hands, perform hand hygiene. And for this specific skill, I'm going to need my syringe, my medication, my diluent, an alcohol swab, and my needle, and also a blunt tip needle. Next, I'm going to make sure that my equipment is not expired. So I verify that my diluent is the correct one and that it is not expired. Next, I'm going to look at my medication. It is not expired, and I'm going to take note of the strength of it and how much I need to be giving, and I'm going to perform my calculation on this side. So for this specific medication, I'm going to be administering 1.5 ml of my diluent into my powdered medication. So I'm going to remove the protective coverings. And with my alcohol swab, then I clean the top of each for 15 seconds or 30 seconds depending on the hospital protocol. So 15 seconds has passed. Next one. And 15 seconds has passed. I'm going to assemble my equipment. So I'm going to exercise my syringe and then pull back 1.5 of air into the syringe. Okay, I'm going to put that into my powdered drug, like so. I'm just going to gently roll it in my palm. I'm not going to shake it. Now all of the powder is dissolved in here. So now I'm going to pull back the amount that I need for my patient. For this patient, I'm going to be giving 1.5 ml. So I have that in air. No. And I want to avoid any air bubbles. So I have 1.5 right here. Take this one out. And I'm going to change my tip with this one here. And I can just keep it like this until I get to the patient's room. Before I leave the medication room, I'm gonna get a label and put it onto my vial or my syringe and make sure not to cover the actual dose. And then I'm good to go to the patient's room.